This segment of CoastLife is sponsored by Beebe Healthcare.
Well, CoastLife, we've got an upcoming important day, National Healthcare Decision Day. I know, we're going to break that down for you a little bit, what it is, why it's important. And to help us do that, we've got Reverend Paula Waite joining us, chaplain with Beebe Healthcare. Tell us a little bit, I guess let's kind of connect some dots for you right now.
Yep.
As a chaplain, talk to us a little bit about your role with Beebe and what you do and kind of why it's important.
Excellent. We are staff chaplains. We have 3 board certified staff chaplains that are at the hospital. We offer spiritual and emotional support to patients and families. We report to traumas, we deal with things that are unexpected.
Yeah.
And unfortunately, we're also there many times at the end of life.
Yeah.
And we're dealing with grief and tragedy and having to really assist people to understand and navigate the healthcare system.
Yeah, I mean, I'm sure for a lot of people, you know, you really are there in their worst moments, in their worst times in their life, or some of the hardest moments in someone's life. And I think to have, you know, some spiritual guidance probably grounds a lot of people in those really difficult times.
Indeed. Well, and the one thing is that we're interfaith ministers. We all come from different faith backgrounds, and when we meet people, we're meeting them where they are.
Yeah.
We're not bringing an agenda in. We're not trying to change them over or make them something that they're not.
I love that.
It's meeting them where they are.
Yeah, it's just it's filling a need when they need you most.
Yep.
So let's kind of maybe switch gears a little bit to National Healthcare Decision Day. What is that? How long has it been around, and why is that important?
In the 1960s, people really started realizing that they wanted to have their own voice in their healthcare decisions. Back then, it was the doctor told you what to do and you did it. That movement moved through into the 70s when the bioethics committees came in and said, no, we really need to have something. And in 1991, Delaware accepted or acknowledged the first living will, which was the effort to get that to say, we want to do advanced care planning, we want people to have that answer.
I love that.
Yeah. And so in 2006, a healthcare attorney decided that we really needed to push this. He saw what we do every day in the hospital. Families being challenged at end of life because they never talked to their loved one as far as what their wishes were. And he created National Healthcare Decisions Day in 2006. The date is actually April 16th.
There you go.
Now you might want to know why April 16th.
Sure.
Well, he picked that date because what is April 15th? Tax day?
Tax day.
There we go. And with that, there is a quote by Benjamin Franklin that is, only thing sure in life is death and taxes. So that is why he selected April 16th. But advanced care planning and that day is really a process. It is about communication, conversations. It's not just about the form. It's about empowering people to say, this is what my beliefs are, this is what my values are, and speaking them and having that conversation with loved ones. Because mainly, we don't want to get to the end of life and have additional suffering or non-beneficial treatment if that's not what you want. So it's vocalizing with those decisions. And now, Beebe Healthcare, we have, for the last 3 years, offered education about National Decisions Day and how to do advanced care planning. This year, we are offering 2 sessions. One is in Lewis at Lewis Library on April 16th at 9 o'clock. I'll be doing a presentation. We will have our palliative care team there to help people fill them out. We will also be offering this in Millville at the Millville Volunteer Firehouse on the 17th at 9 a.m. also, and we will be there until noon. And importantly, both locations will have the American Sign Language available and be there to help people that are need that assistance.
That's fantastic. I mean, you really have the whole community covered. So who would you encourage to come out and attend these educational events to stay informed? Is it sort of the general public? Is it people that are maybe knowing that there's a loved one in their life that may be approaching that sort of end-of-life care?
Anyone over the age of 18 should have an advance directive, because a sudden illness or an accident can happen at any time.
That's true.
So we encourage people of all ages to come. We're happy to walk through it. We can explain it. And it works together with their family members. So many times we will have families come to experience this and to understand and be able to help them through it.
I love that. So for folks who are interested in attending these events, is this something that they need to register for ahead of time? Do they need to, just show up at the door? How does this work?
If they would go to the Beebe website, to the calendar of events, and there's a registration QR code right there that they can get in there.
Fantastic.
But if they show up, I'm going to welcome them anyway.
Ah, that's amazing. Paula, you're the best. This was so great to chat with you, and I feel like I've really learned a lot that I didn't even know was necessarily something that we had in Delaware. So thank you so much for all that you do with Beebe and for helping educate the community.
Wonderful, thank you.
Of course. So we'll give you a minute to check that out. If that's an event that you're interested in checking out, you'll want to go to Beebe's website so that you can register and so that you can show up in Millville or Lewis. But coming up on CoastLife, we're also going to be chatting about why it's important to get middle school age children involved in education when it comes to protecting our wetlands. That's on the way.